Hello, my name is Donna Williams and this is a little video about low-cost, no-cost strategies for challenging behaviours. I guess the first thing to talk about is what are challenging behaviours, and I guess that really depends from, it's interesting, what's challenging in one culture is completely non-challenging in another culture. What one family finds completely overwhelming, another family hasn't got a problem with, vice versa. So I think that some of the issues with challenging behaviours include things like exposure anxiety, where you have involuntary avoidance, diversion and retaliation responses. So essentially this is somebody with a kind of hair trigger self-protection response that is jumping in before they get a chance to voluntarily express what they actually meant to say or do. Now, one of this very easy to address in a low-cost way, because you're essentially got someone who is like a feral cat in a dog world, and the more that you are watching, waiting, wanting, the more this person is going to be compelled into self-protection responses. So if you want them to calm down, you stop acting like dog and start acting like cat. You start playing hard to get, small doses, always leave them wanting more. This means you also get into your own space, you behave as if you are really interested in your own thing rather than fixated on them, and then there's less reason for them to constantly be triggered into self-protection responses. It doesn't mean you just leave them to their own devices, but it's how to herd cats. So part of an indirectly confrontational approach may be that if you want somebody to do more of something, this may not be the kind of person that encouragement works with. Maybe the more that you encourage them, the less that they do. So you can actually use your reverse psychology with those people. You can actually use no to trigger yes and yes to trigger no. You can use the yes but strategy, which is, for example, there was a boy who was eating less and less and less until he was only eating one chip and one pea, and this was his entire lunch. He was going to starve himself to death. So they said, "Oh, what can we do to make him eat more?" And I said, "Give him half a chip and half a pea." And he did this. They did this. He was really perplexed, and he came straight back with the plate, and he asked again. I said, again, give him half a chip and half a pea. So by actually giving him less, they caused him to request more. Similarly, there was a girl, she was eating rocks, and they tried everything to, all the positive reinforcement for good behaviour, and, they tried all the reward systems, they tried all the standard stuff. I said, chase her with large rocks and offer them enthusiastically for her to put in her mouth. So they did this, and sure enough, she found their over-enthusiasm so intimidating that she stopped eating rocks, because she began to see it as an invitation to them to then pursue her with demanding that she tries even more rocks. And so this saved her from having to get operations for rocks she was swallowing. It's quite good. There was a man who used to smear his feces into the radiators, into the heaters, in a residential place, residential care. And they asked, what can we do about this? Every day he keeps putting this shit back into the radiators, and they have to clean it all out. And I said, well, it's a very territorial thing. Number one, don't invade his space, his room, unless you really have to. Number two, he obviously feels really empowered because you hate this smell. And so he knows you're not going to want to stay in a room that smells like his shit. So what I want you to do is that next time he puts this in the radiator, I want you to bring everybody in and act as if it's the best smelling coffee you've ever smelled in the world. Invite them all in to smell the fabulous aroma of what he's done today. Well, they did this for a couple of days, and then this man who'd been doing this for probably about a year stopped and never did it again. So I also with some people, there was a man who was vomiting and making himself vomit. He put himself into hospital with this, and they tried everything to stop him vomiting, and they couldn't stop him. This was a man who was very, very anxious, socially anxious, very couldn't cope with any degree of fuss and gush and attention, and so none of the standard things were going to work. And what I said was, as bizarre as it sounds, if you clean up the latest vomit and then hang the cloth up on the wall, on the board, as if it's a picture, and say, oh, this is what he's created for us today. And sure enough, it caused him such a degree of exposure that his vomit was being used as an act of expression, as an invitation to share with other people. He stopped vomiting. So he had been doing it as a way of reinstating his own autonomy, this feeling of, I guess, making everybody worry, but equally creating a sense of distance in that worry. And so what we did was we used it to teach him it would not create distance, it would actually create connection, and then cause him to reject that. So that ultimately kept him safe. So sometimes when we are dealing with a challenging behaviour, although it's fine to think about the standard approaches, if those aren't working, if somebody actually thrives on distance, thrives on power, you may have to use a very reverse psychology type approach. So another one that I think can be a really challenging behaviour is when you've had carers who have progressively given in to self-injurious behaviours, and the person will indulge in these to force the carer to take over and do more and more and more. This is akin to what we would see in dependent personality disorder. Essentially, people who become convinced of their own inabilities and who invest in staying incapable because they fear that if they became capable, their carers would leave and they would be abandoned with their disability. And what I found is if the carer says, no, you can do it, they become really distressed, commonly outraged, sometimes self-injurious. And yet if the carer appears to develop dementia and behaves as if they have suddenly lost their mind and can't remember how to do anything competently, what's interesting is if they're convincing enough and they don't watch and wait and want, the previously incapable person starts to actually take over the tasks. So I've used this with children who couldn't open a door, who couldn't put on shoes, who couldn't dress, who couldn't wipe their own bum, who couldn't go upstairs, who couldn't feed themselves, who couldn't brush their own hair. And when I had the parent brush their hair the wrong way, put their shoes on the wrong feet, appear to be unable to open the door, when I had the parent throw a tantrum and act as if they were essentially the more incapable person, I found that these people who couldn't essentially ultimately did help themselves and begin to use the skills that they very much feared the independent use of. So I think that is worth at least keeping in mind. When it comes to challenging behaviours, another area where this commonly happens is where some people are naturally solitary. And if a person is naturally solitary, they are more cat, less dog. And so these people, whether they have exposure anxiety or not, and a lot of them do, but they may thrive on distance, and this can mean that they enjoy putting saliva all over themselves. They might enjoy having their hands down their pants and making all these smells on themselves, because they know that you will then not want to sit next to them as much. You won't invade their space as much. They will feel in some degree of control. So one of the things to do with this is to get out of their face. Be more cat, be less dog. It doesn't mean go away. It doesn't mean leave them to their own devices. It just means do your modelling, then leave them some space to discover for themselves. Come back, do some modelling, then leave them to their own space. Facilitate their ability to teach themselves. Learn how to be as socially non-invasive and low-key as possible. These are not your, good girl, yay, people who thrive on a sense of, say, achievement or recognition. Some people don't thrive on that at all, and that's the really important part to know. And then you need to say, well, what do they thrive on? Well, maybe they were happy to do an activity provided they felt it was their own discovery, provided nobody was watching. And then how do you facilitate that? How do you set up a learning situation or an activity where you then do the modelling but not in their face, leave the room and allow them to explore that and to get it done? Sometimes starting someone with physical patterning, but if you do it in their face, they will keep giving you that activity and turn themselves into a puppet. You'll get a prompt dependency situation. So don't get opposite them. Come along and sit beside them and hand over hand get them started, and then fade out that support. Don't overly use their name. Keep those things quite low key. You don't have to go, oh my God, it's so great, yay, because that's just way in the face for many people with quite solitary nature. So what you can do is you can say, you can praise the object, not the person. You can say, it's really good when a person can put away the cups, and then you walk away. You don't say, oh wow, look at you, you've put away all the cups, good for you, because it's just too irritating. It can feel like an emotional rape for some people to feel that socially vulnerable and fixated on, to be made into a case, to have the verification that someone who's in this position just can't see the personhood of them, can't see the sanctity of their own space and their own learning and processing time. So keep an open mind that not everybody needs the fuss, gush and overt praise. Some people actually work better when the approach is more low-key and more indirectly confrontational. And that does not mean that you're not doing your job. It doesn't mean that you're that you're leaving them completely to their own devices. Being good at modelling and facilitating self-learning, and then exiting to give them that space to get started, is actually a skill. And if they don't get started, then learning how to facilitate that physically in small doses, and then off to the side, get on with your own thing, come back, do a bit more patterning and away, a bit more patterning and away. Small doses, play hard to get, always leave them wanting more. When people are self-protected, the biggest thing, the biggest challenge they have is learning how to want. If they don't want to do anything, they can't find the motivation. So if their biggest reason to self-protect is because they think other people are watching, waiting, wanting, if you turn the heat down on all of that fixation, you may actually find that they're able to do more than if you were watching like a hawk and making it your job. So I hope that's been of use. There's a lot in the area of challenging behaviours. On the self-injury side of things, one of the things that I've done when people are doing the biting, doing the punching, doing the kicking, because saying no, no, no does not always work, and for some people that really inflames the situation and makes them even more retaliative. They enjoy the fact that you don't want that to happen. They enjoy the autonomy, the sense of personhood in being that, you know, that rebellious, that individual, that they're not complying. And so one of the things that I found sometimes works, if they're hitting me, I'll actually take their hand and I'll make them hit me, and I'll say, soft hitting, nice, gentle, soft hitting. And because I'm actually saying yes, but I'm taking their hand and I'm making them hit me, I actually find they pull back and they don't want me to get them to hit me. So I've actually grabbed the kicking foot and I said, give me that foot, nice gentle kicking, and I'll try and make the foot kick me, and they'll usually pull back. How dare you, don't you make me kick you. With the biting thing, it's very hard to bite if you can't breathe, so holding this usually makes them let you go. And I find that if I'm pulling away, they'll actually bite more. So if you push towards and say gentle biting, nice gentle biting, and you've got here, they've got to let go of you in the first place, but because you're invading their world and encouraging them to do what they thought you don't want them to do, then you can actually sometimes cause them to lose interest in this, because it no longer has that distancing power, and they are much more interested in not complying and feeling that sense of their own territory and their own space, which they get from not biting you. So I hope that's been useful. Okay, thank you. Bye.